Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección.
Hello and welcome everyone to the Friday Update with Mendocino County Public Health. My name is Cameron Brown, and I'm very happy today to have Dr. Andy Coren, our County Health Officer, with us. And we'll follow our standard schedule today. First, we'll get the COVID updates from Dr. Coren. Then we'll jump into taking some questions from our local media. And we'll also be looking for any public questions on Facebook or YouTube. So let's jump right in. I'll hand things over to Dr. Coren.
Hey, thank you, Cameron. Can we have let's see, I don't know which slide you have up there. There's the introductory slide. Can you put up the slide? This first slide is from Dr. Erica Pan, our state epidemiologist and assistant health officer for the state. The next slide is what we're talking about. I know that everybody's fed up with this COVID epidemic, and we have some good news today, but it must be taken cautiously because the pandemic is not over. So I want you to see these three lines on the graph from left to right. The blue line, and this is for the state data. We'll get to the local data in a moment. But the state data shows clearly a peak in the early part of January, and these are cases, the blue line. The next line is actually a normalized line of deaths that fits on here just to show that that it is also peaking. And then the next line, the yellow line, is the hospitalizations. And so you can see that we're getting to a point, and again, the yellow bar is the area of more uncertainty because data needs to be reported and digested by the various platforms and so on and so forth. So it's good that we're probably in the state past the peak of this pandemic in cases. If we go to the next slide, please. This is what we have for Mendocino County, and it's just case numbers. It increased and was increasing up to about 2 weeks ago, and it reached as high as 149.6 per 100,000 per day. That was almost three times higher than the highest daily rates we had during this entire pandemic. However, here, as well as elsewhere in the country, our case rate has begun to fall, and you can see it's almost plummeting as it falls. The current case rate on our dashboard is 125.8, and that's with a 7-day lag. A more significant drop will be reported in the next week, about 30%. And this week, we're seeing even fewer confirmed cases reported. This does not reflect either the thousands of over-the-counter rapid antigen tests. So we're relying less on case numbers to assess the progress of this pandemic, although it is important to see this. But the other indicators of community transmission concur. One is test positivity, which is down to 18.6%, which is a drop of 5.5% in the last 7 days. And another indicator you may have heard in the past is R effective, which shows an indicator of spread. In other words, how many others will a person infected with COVID pass it to? And it was almost 2, and it has come down to 0.51 on February 1st. Another important indicator, and one we're probably leaning more to rely on, is COVID hospitalizations, and these plateaued this week. Currently, we have 19 Mendocino residents in hospitals, including one newborn with COVID in UCSF. In Mendocino County, as of February 3rd, we have 1 staffed ICU bed and 0 med-surg beds, reflecting the stress from nursing shortages and non-COVID cases. So the proportion of COVID that's filling our hospitals during this surge has been significantly less than it was in prior surges. The deaths are still rising with a new total of 117, and mortality, of course, always follows the peak, mortality follows hospitalization as it peaks. So we then look to modeling, and the state has provided us from their new modeling group some interesting slides. We can see now these colors show different modeling groups, different academic modeling groups. But you can see in both of them, the cases on the left and on the right, hospitalizations, that the colors seem to converge going downward, down around the end of February, beginning of March. And that's a little less low when you look at hospitalizations. The dots are actual data, and that's what it stops partway. But it does show in both graphs that it seems to be the surge seems to be coming down toward the end of January and through March. And if we look to the next slide, it shows the regions. And of course, in Northern California, um, we oftentimes follow the rest of the state. We're rural, and there are smaller counties that make up our region. The upper right box is what reflects Northern California. And you can see that although it's a little messier, it does seem also to be coming down in the range of March, probably a little bit later than the other groups, but we're following what the state shows. Remember that the science is not exact, especially with the smaller numbers in our rural counties and undercounts because of antigen testing. Another caveat we've always made to predicting this is the possibility of variants. And today, many of you have read that there is a new Omicron subvariant. It goes by the name of BA2, with the original Omicron variant being named BA1. They'll probably come out with some better sounding names in a little bit. But anyway, this subvariant was initially noted in Northern Europe, but it's also spread to Africa and Asia. And we have seen 52 cases identified in California. So far, little is known about its virulence or its immune evasion. It takes a while to tell how it reacts. But a small early study in Denmark did show increased household attack rate compared to the current Omicron. So it may actually be faster spreading. Remember, many of these variants and subvariants die out before they spread very much, but clearly that did not happen with Omicron, and it rapidly overtook Delta. We don't have the data or the experience with BA2 yet to know what's going to happen. Nevertheless, the state modelers are predicting a return to near pre-Omicron hospitalizations and deaths sometime in March. The county is currently sheltering 19 people who cannot isolate or quarantine on their own. And we have recently had 8 outbreaks in the county, for which we have requested and received outbreak assistance visits and some calls from the state to help mitigate many of these. Many have ended or are ending. They're all seeming to come under some control, but it takes a while before we really declare that that outbreak is ended. The schools have documented no outbreaks or in-school transmissions since the holidays. So the high numbers of positive antigen tests were from community, mostly household transmission, and we're seeing the numbers of positive antigen tests through the schools also dropping by about 30% in the past week. So again, I want to reiterate, the schools are the safest place to be. I know there are a lot of parents out there who are very concerned about the numbers that they're hearing and reports from their children, but the schools are doing a fantastic job in catching cases before it's spread within the schools. Let's move on to vaccinations. On January 31st, the FDA gave full approval to Moderna, the adult vaccine. It's now being called Spikevax. It is the same formulation that's been tested over the last year, and it's got a full approval down to 18 years old. Pfizer also has applied to the FDA this week for emergency use authorization of its vaccinations for children between 6 months and 5 years old. If we can go to the next slide, I want to show you, let's see, some information on efficacy. This also comes from CDPH, Dr. Pan. And the orange line shows how the efficacy of our current vaccines decreased in terms of case rate toward the end of December. But as you take into consideration those people who are boosted, it comes back up. So without the booster, the efficacy of our mRNA vaccines, that's what this one shows, fell to only 60%. But with the boosters, it comes back up to over 80%. And when you look at hospitalizations and deaths, it's even more dramatic, the effect of the boosters. So where those who were fully vaccinated but not boosted, hospitalizations efficacy went down under 80% and climbed up over 90% when we looked at those who were boosted. And the same thing with deaths. The efficacy came down to a rate in the range of the mid 80s, still very effective. But then with boosters, it came up to the mid 90s. So these are very, very effective vaccinations. And this is shown also on the next 3 slides. It may be easier to visualize this. The first slide shows that the unvaccinated are 7.5 times more likely than people who are boosted to become a case, to get infected. And the next slide shows similar for hospitalizations. People who have not been vaccinated were 14.9% more likely to be hospitalized than those people who were boosted. And the final slide in this set was the death in the unvaccinated is 30 times more likely than those in the boosted group. Now, the blue lines in each of these show those people who were vaccinated but not boosted. We can go back. Let's go back to the first one that shows the cases. And again, here's the blue line. I failed to demonstrate that. And the blue line is those who are vaccinated. Those who are boosted are on the green line, showing very little morbidity when you're boosted. And this is also the same thing with the death rate. So we know also that the United States has the highest rate of mortality of all the large, high-income countries in the world, and it correlates directly with our having the lowest vaccine rates in that group of countries. Why is that? Many indicators are related to race, ethnicity, poverty, but new research just published in The Lancet also shows a correlation of fatality with a level of trust in government and in each other as major factors, which also may explain the partisan divide in outcomes that we see in the United States. And that's one of the reasons why Mendocino County and Mendocino County Public Health have really valued our collaboration with our community clinics and as well as the Hispanic and Native American partners. So moving on to vaccines. Vaccines have been an important focus of our health department. As of February 3rd, Mendocino County has administered a total of 148,679 vaccines. And this represents 71.7% of those eligible people in our county over 5 years old have been fully vaccinated. In California, that number is a little bit higher, 74.7%. The people over 50 years old are 80 to 85% fully vaccinated, and that's actually a bit higher than California, but we lag behind the California rates in people younger than 50 years old. And those are the ones who are getting the infection, of course, much more rapidly. As far as boosters go, Mendocino County has had 37% of our population who's eligible get boosted, and that is better than California. And in those people over 65 years old, 61% have had boosters, and over 50 years old, 45% of those people have been boosted. New research shows also that the boosters are 90% effective against COVID hospitalizations. Oh, something's bouncing around here. Okay. But very few people have taken them, and that's one of the things that I wanted to point out here. I want to focus next on COVID in children and children's vaccines. It is, let's see. So I should also say that each week there are vaccines available at the Department of Public Health or the fairgrounds in Ukiah, as well as through the clinics around the county and in pharmacies. Tomorrow, we're going to be having a vaccine event at Ukiah High for all age groups from 12:30 in the afternoon to 4:30 in the afternoon. Do we have that slide up, that poster? So Omicron can be severe and fatal, especially in the vulnerable and in the non-completely boosted. Long COVID is also a concern as an outcome that's being actively researched now. So this is why we are really encouraging people to get vaccinated and boosted. So again, let's start focusing on children and their vaccines. A lot of people are thinking that this doesn't really affect children, but I think this slide shows in terms of hospitalizations for children 0 to 17 years old, the numbers have increased to almost 3 times, or a little over 3 times, during the period of the COVID epidemic. And this is very clear. This blue line shows the increase. It has been coming down recently, which is a good thing, but it's not clearly to pre-pandemic levels. Over 2 years, now the next slide is a poster on children's vaccines. Many ask, why vaccinate the children? Isn't COVID like influenza? So in 2 years, 800 COVID deaths have occurred in children, and that compares with 200 influenza deaths over the same period of time. There have been 8,300 hospitalizations, and 30% of these wind up in the intensive care unit. The risk of hospitalization is 11 times greater in the unvaccinated child, and COVID is now the 9th leading cause of mortality in children. But few kids have been vaccinated yet, and the disparity is huge between the wealthy and the poorest neighborhoods. So again, we want to encourage people to get vaccinated and boost themselves, and also to be sure that their children are vaccinated. Another positive development that we have now is that we're getting some new outpatient, very effective treatments for mild to moderate COVID that can be prescribed by providers. The supply is still scarce, so you must have high risks at this point, and for the most cases, unvaccinated people would be the highest risk and be eligible first. So we encourage people to call their provider early in the course of their disease because it has to be prescribed early in order to be effective. So in summary, we have good news and bad news this week. Omicron surge seems to be nearing an end, or at least a better place, though there will be more casualties and deaths through March. We have vaccines that are very effective, especially when they're boosted, and we're beginning to see outpatient treatments that may help bring this pandemic under control. But there's a new subvariant, so we're keeping an eye on that. And in order to deal with all of this, the most important thing that we can do is to get vaccinated and boosted. The less multiplication that we can have in the society and the civilization, the less there's likely to be more variants. And this last variant, though it spread rapidly, did not have a high virulence level, high mortality rate, and so on. The next one could be much worse. We just don't know. So get vaccinated and get boosted. And don't forget the other layers of protection. Avoid high-risk activities if you can. For example, large parties and gatherings. Stay home if you're sick or if you test positive, for sure. And postpone travel. Also, we've been talking about upgrading masks to either a surgical mask or a N95 mask. I wanted to put up the next slide about where to get COVID tests now through the federal government, and that is through covidtests.gov. And you can call 1-800-232-0233. And with that, I'll end this presentation and welcome whatever questions you may have. Thank you for listening.
Thank you, Dr. Coren. So for the structure of our question and answer session, we'll go through different rounds. We have 4 media outlets today. And so we'll go through one question per outlet. If you need to ask a follow-up to clarify any information, that's perfectly fine. But we'll just try and keep it to one follow-up question so we can get to everybody. And also try and get some Facebook and YouTube questions from the public in there as well. So we have it 35 minutes, so I think we'll be able to get to everybody for at least a couple questions. So let's begin with Susan with Independent Coast Observer.
Hi, thank you very much, Cameron, Dr. Coren. I have been getting phone calls from parents complaining that the testing at Point Arena High School is voluntary. Supposedly it was going to be required for all students, but apparently they've made it voluntary. And supposedly there's up to 16 people who have tested positive that still rode the school bus to school because it wasn't known that they were positive till they got to school. So that exposed all those kids. And the basketball team seems to be particularly hard hit. And yet none of this is getting reported by the school to authorities, supposedly. So I wanted to check that with you and see, is that true? Are the schools, is Point Arena High School reporting positives?
Yes, Susan, and thanks for your question. All of the schools report their positives to us. I would caution against sort of anecdotal reports. I've gotten a number of letters also. The basketball team is testing twice a week. We do not have a mandate that students must be tested in a surveillance way. The teachers have been testing in a surveillance way those who have been non-vaccinated, and these all get investigated by contact tracing on the site by the staff, and also it's overseen by our school's liaison, who is probably the most experienced in contact investigation tracing. So we are definitely seeing a decrease in the number of antigen tests that are coming positive. And we want to keep those schools open. I can understand that the parents are very concerned, but as from a population health point of view, the safest place for the kids are in the schools, and the activities that we have at this point in terms of masking and separation, trying to minimize the contagion while eating together, for example, the ventilation, and the quarantine that we're doing. And quarantine now is in the schools for the most part. We've not found that it's more helpful to send children who get their contact in the schools to send them home. So that's a difference with children who get the COVID contact outside of school. But even if they're in school and they're a contact, if they don't test positive, we have them come into the school. So that has been working not only here locally or in Point Arena, but throughout the state.
Okay, great. So what if someone at home that those students are going home to is immunocompromised or otherwise vulnerable? How do you handle that if you know the student is positive and they're quarantining at school?
Oh, no. Anyone who tests positive has to be isolated. It's those who have been in close contact, that's called quarantine.
Okay.
And all of those children have a note sent home to their families to alert them and give them advice on how to do it. When the children are in the school in quarantine, it does not absolve them from their quarantine when they're out of the school. So they should still be watching what they do. Now they can do after school activities, but they shouldn't be out partying, for example. They are in quarantine when they're outside of the school activity or outside of school.
Okay, thank you.
Great, thank you. And let's move on to KZYX.
Hi, thanks. Can you hear me?
Yes.
I'm wondering if you could go into a little more detail about the therapeutics that are available. And since it sounds like Omicron is hitting kids fairly hard. Can you talk about how effective and safe the therapeutics are for use in the pediatric population?
Yeah, so the therapeutics that are available, let me pull my cheat sheet out here. I'll keep everything in my head, but there are some that are available for children under 12. Remdesivir has been approved for adults and children greater than 12. And actually there is a dose, the physician who's giving it needs to change the doses for the children under 12. And that's very safe. And all of these are effective in the range of 80 to 90%. We try and get children and adults who are early in the course of their illness within 5 days, or it's not going to be very effective. So people have to be alert to let their provider know, and they have to have mild to moderate symptoms. And it's usually, especially because these are all very scarce, they're being prescribed based on certain risk categories. So people who have high risk underlying conditions, elderly, and have not been vaccinated, they would be in the first group that would get a prescription. And then those who are a little younger, but also unvaccinated or have other conditions would also be eligible. There's 2 groups now that we're trying to focus on, and that pretty much summarize who it is. The other 2 groups involve vaccinated people, but who have a high risk of disease, and they may be over 75, or they're even 65 and over, or even under 65 if they have clinical risks and have been vaccinated. But at this point, with these being so scarce, for example, we're getting lots of 20 into the county each week, and that's clearly less than what the need is. But if people call their provider and they're within 5 days, they have mild symptoms, their providers will prescribe it. Whether it's available is very problematic, but we hope we'll get more in. There are, I mentioned remdesivir because for children, that's the one that is authorized. There is also probably the next most important one that we should go over are the oral tablets, and that is Paxlovid, and that's a combination of 3 various different tablets. And let me just see if I can get that here. All right. So Paxlovid is another, and then monoclonal, and then another one is molnupiravir. That is a little bit less effective than the Paxlovid, and the molnupiravir has some contraindications for people who may become pregnant or are nursing, and also children because of some potential, not proven, but potential concerns about affecting the genetic material in in those people, and also in bone growth. The Paxlovid have contraindications, and it's important for the physicians to go through them because it's a combination of 2 medicines, and there can be drug-drug interactions with some of the other medications that they may be on, and it's only a physician going through each one that they would be able to go through. Another very important antiviral agents that we have now is Evusheld or Evusheld, and it is a combination of 2 monoclonal antibodies, but it is long lasting. So for those people at the very highest risk who've recently had a transplant or are on certain kind of medications that really reduce their immune competence, they are given this, and it's again parenteral or injectable medicine, but it protects them before they're exposed. So all the others are post-exposure prevention of severe disease, death, hospitalization. They're very effective for that. But this is for those people who are at the severest risk before they get infection, and it would presumably be they'd have another injection every 6 months to keep that prevented. And then there is another one mentioned, remdesivir. Sotrovimab is now the injectable monoclonal antibody of choice, where we used to have RegenCov and bamlanivimab, and I can't pronounce it, but it's BAM-EDI is how we talk about it. And those are no longer effective against the Omicron, whereas the ones I've just mentioned, they're all effective against Omicron. Does that help?
It does, thank you. And you said we get some remdesivir into the county, and I'm wondering if those other medications are also available locally.
Yeah, so the parenteral medications are coming through Adventist Health, which has, of course, 3 hospitals in our county. And it's going to Adventist Health in Ukiah, and they can move it around, and they do with other medicines and other treatments as they do. So the ones that are going that need to be infused or injected at this point are going to Adventist hospitals, and the others are being distributed to pharmacies. And there's a pharmacy in Fort Bragg and a pharmacy in Ukiah. And we haven't been able to find, well, there's a pharmacy that could have been approved, the Rite Aid in Willits, but neither the Rite Aid in Willits or Fort Bragg want to have that yet. I think they have some internal protocols that they need to get out. So we're getting, just to give you a sense, 20 of these courses of medicines each week. And so it's a challenge to figure out how to get them. And they also will not break up those numbers. So we've sent them and are sort of rotating the pharmacy, which I know is not ideal. But hopefully in the next few weeks, we'll have many more or much more of these medications coming into the county. That's our hope.
And one more quick follow-up. What is a course of medication is? That's 20 courses, so it's basically 20 cures for 20 people who are sick, right?
Yeah, it's 20 cures. We hope it's a cure. But for example, Paxlovid is 3 pills twice a day for 5 days. That's one course. So it's 6 times 5 is 30 pills. And they're 2 different medicines. So it's one of one type of medicine and 2 of another.
Okay, thank you.
Yeah.
All right, thank you. And let's move on to Mendocino Action News.
Good afternoon, everyone. I have a question. Dr. Coren, you had just brought up that Pfizer recently requested emergency authorization from 6 months to 5 years for the vaccine. But going backwards, the 5 to 11 has already had the emergency authorization for Pfizer. When do you believe the FDA approval will go through? It is my understanding Governor Newsom made a statement that once it is approved, the schools will start to mandate. And I thought that was coming up soon. So could you talk a little bit about that, please?
Yeah, so the Pfizer for 5 to 11-year-olds is still only an emergency use authorization. And my understanding of what he said is when they are fully approved, in other words, it's not an emergency use, but they have enough experience, there's enough literature that they can say, we believe that this medicine can be distributed on a general level, general basis with minimal risk and so on and so forth. So it's another hurdle that the FDA and the other advisory organizations go through. That hasn't happened yet. The priority has been to give it to all of the groups in our society first. So they're looking at the 0 to 5-year-olds. And I think that will be next. And we're hoping that they're going to fast track that so that some of those will, or that type of vaccine from the 6-month to 5-year-olds will be available. Boy, this is middle of February. I think that they're going to meet on the 15th to initiate the discussions about that. They're all reviewing literature at this point, but they really, chew this over, and there's disagreements that they work out on the committee level. But we're hoping that in the next 6 weeks, we'll get the vaccines approved on an emergency basis for the 6-month to 5-year-olds. And then hopefully we'll have a more full approval for the 12 to 15-year-olds. And I can't look ahead and see when that will happen. But so far, the safety of these vaccines, which is the key thing that moves it from the emergency use to being fully approved, the safety of these has been quite high, better than it was for. There's fewer concerns. Let me put it that way, for the children's vaccines than there were for the later teenagers and adult vaccines. So hopeful.
Okay, so just to reiterate, it sounds like those deadlines that we had talked about before you mentioned have kind of been extended out a little bit more now.
Yeah, I think they're extended out. And I think, when the governor made his announcement, I certainly don't want to, double think what he said or what he'll do in the future. But I think what he was saying is as soon as we have effective and safe, authorized vaccines, then he was considering adding them to the list of mandatory vaccines for entering schools.
Okay, thank you.
All right, and I think the last one we have is Mendocino Voice.
Hey, good afternoon, everyone. Thanks for the presentation. It's good to have some good news, even if we have to remain cautiously optimistic. But I wanted to follow up and get an update on the outbreak of COVID-19 in the county jail and what public health officials, how they're working with jail staff to mitigate and prevent future outbreaks. Also curious on that. I think I heard this correctly that Dr. Coren, you mentioned there were 8 outbreaks in the county and there was some assistance requested from the state. I was wondering if this was one of those outbreaks.
Oh, absolutely. Around the state and around the country, there's a lot of concerns about jail outbreaks because it's a congregate living kind of situation and it's very hard to control them. In our jail, let's see, I believe, the total numbers of people, including staff, is over, let me see, I have it right here, is a little over 200. A large number of the nurses and staff were infected, and then a large number of the inmates were also affected. And so I did an actual tour of the jail and got a sense of how it's laid out and how they're screening the deputies who come in, the vaccination rates of the deputies, and what kind of protective equipment that they're using. And I wrote up a whole report on that, and we took it to the outbreak team with CDPH and had a fairly substantial conversation where they came up with recommendations about PPE, protective equipment that each individual in the jail uses. And the pre-screening, the questions that we all ask. So we addressed some of those things. The ability, as soon as somebody has any symptoms, to get them tested. And so it's not just on a twice a week level, but also if any inmate has any symptoms or any staff that's working there, deputy, cook, whoever it is, they get tested on the same day. So we made some modifications. And in the next couple of weeks, we're going to have an industrial hygienist, someone from Mendocino County from our environmental health, and CDPH, an industrial hygienist, which is familiar with working in jails, evaluate and make some recommendations. So we're trying to address both the masks and PPE, vaccination rates, pre-entry testing, and also the guards are tested on a very regular basis within the jails, or the staff, I should say, not just the deputies. And so we try and address that. And so it's very consistent. And moving forward, the numbers have come down. They've gone down by almost 75% when I talked to them earlier this morning. So we're making progress. But nobody has had to wind up in the hospital, or anyone has passed away, either deputies or inmates. We did apparently find someone who was high risk and took appropriate care of that person. So we're trying to get our systems as fine-tuned as possible. We know that that's a very difficult population and situation to work with. Just to give you an idea, a comparison with nursing homes, we had a number of nursing homes that were affected. When nursing homes are affected with a case or two of COVID, they segregate those COVID cases into a group of rooms, and they have special conditions for the nursing staff going in there, the protective equipment, and how they care for themselves, so they don't spread it around to other patients. They only have certain duties to take care of while there is that kind of an outbreak in a nursing home. And so you can change the locations of patients in a nursing home, those who are currently infected, those who may have been exposed, and those who we know, as well as anyone can know, have not come in contact with this disease. And that's a very effective way at mitigating an outbreak in a nursing home. In a jail, you have a number of other overlying issues. And so prisoners are assigned to certain cells based on security issues as well. And it's very hard to move them around. So one of the things that they do in the jail also is they look at who can be discharged from the jail, who can be released. And they do some early releases. I don't know if you remember, a year ago, there was a lot of releases from the state prison system. But we do a very similar thing with the local jail. Does that answer your question?
Oh yeah, no, that's wonderful. I have a couple things I wanted to clarify though. You said 200 people were positive for COVID-19, or was that the total population, including like staff and inmates?
Total were positive, was over 200.
Okay. And then I was just curious, with the PPE, going on the tour and kind of seeing how they were doing things, would you say that the PPE was inadequate for the staff?
No, it was actually getting in their way.
Okay.
When we
Okay.
reviewed it with CDPH, they said, you know what, in the early days that was useful, but now you don't have to do a lot of that. So we actually reduced that. And when you reduce some of those burdens, it means that the adherence to what's necessary goes up. There's a little bit more tolerance for addressing some of the other things.
Yeah, okay. And then one last thing to clarify, because there was so much information in that response, and thank you for it, is there, it seems like you have made a report that your department has shared with CDPH, and then there's going to be a report done by this industrial hygienicist. Will those reports be available to the public?
Probably not. I suspect not.
Okay. All right. Thank you so much.
Mhm.
Great. And in looking at Facebook, I don't see any questions that Maya was not able to answer on Facebook. So we'll jump into a second round with our news media and keep checking Facebook as well. So let's go back to Independent Coast Observer. Susan, are you still with us? Did you want to ask a second question? Okay, well, we'll see if Susan gets back with us. Let's move on to KZYX.
I was wondering if you could give a little update on the contact tracing, and I'm especially interested in the county's work with the Mendocino College, which now has a system where you download an app onto your phone and scan your way into buildings, and it's sort of like it looks like a unique program in the county. And I'm wondering if you could talk about the county public health's work with the college, and if that is a system that you see sort of spreading throughout various institutions locally.
You know, that's separate from what we at Public Health have set up. But the head of the college has been very forward thinking and has gotten that system down with probably other community colleges that are using it. There is the system. It's a California system. Well, I think it's. I don't think it's. Is it vSafe? Uh, it's an electronic system where when you get your tests through the state, they actually report in a secure manner to this electronic platform. And if you're positive, you're tagged in such a way that your iPhone must be broadcasting that. And others who are part of the same system will pick that up and know if they have been in contact with someone who has tested positive, and then therefore they should go and get themselves tested. And I thought it was vSafe, but I may be wrong. Yeah, I don't have that.
So
in front of me.
it sounds like the system would not work if you haven't been tested recently. Like, just to use myself as an example, so I don't violate anybody else's medical information. I'm vaccinated, but I have not been tested recently. So if I swipe my way into the building, but then I get a breakthrough case, then there's no way for the system to know it and be useful in a contact tracing way. Is that kind of accurate?
So
way
I
to
don't
follow
know
it?
about that specific system, but the way I understand these electronic systems work is if you are in the system and you have been tested, or even if you've been vaccinated, it goes into a repository, a platform. And then if you pass by someone who has been tested and they have it on their phone, then it would tell them, or it would tell you that you've passed by someone. I think it's more sophisticated than just passing by. It's within a certain amount of time and a certain proximity. So,
Okay, so it's not, so it would have to be an actual exposure, not just being in the same building as somebody who
I
had it.
believe so.
Right,
Yeah.
okay,
Yeah, it is. It's vSafe.
okay.
Yeah, so you can just put that into your browser and you can download the apps, and they're using that. They first rolled that out among a lot of colleges. It's a smartphone app.
And can you talk about how that ties in or does not tie in with the county's current contact tracing methods?
No, it's not tied into what we're doing. And as the numbers have gotten so much higher, let me say this about contact investigation, contact tracing. It's very clear that what has to happen as we move forward, people have to take responsibility on their own for getting themselves vaccinated and tested. And if they have symptoms, stay home. And so this is another thing to help the individual, as well as getting their tests, online or those kinds of things. So it is, we're moving to a situation, hopefully, with this pandemic, where the diagnosis is something that's made by individuals or with their primary provider, and they know how to take care of themselves. And if they talk to their provider, then appropriate care is given to them. And if they need treatment, then that's taken care of through their medical providers. And it doesn't require the Department of Public Health to be involved in all of that. So that's what we're hoping. That's what we're hoping to move to, that kind of a situation.
Thank you.
All right. And Susan, did I see that you unmuted? Are you back with us?
I'm back. Thank you.
Great, great. Okay, go ahead.
Thank you. I was wondering if you have heard if anyone who's sent away for those home tests from the federal government has received them. I personally sent away on the first day and haven't received them.
Yeah, so it's variable. I've heard that from some people, but I've also heard that people have gotten them already.
Oh,
So
they
it may take
have.
some time. Yes, yes, we have definite evidence that people have gotten their tests.
Okay, great. And the other question is, can you tell me what the criteria is in Mendocino County for closing a school?
Yeah, there is no criteria for closing the school in Mendocino County, or I think generally accepted throughout California. We really want to keep the schools open. So if there's a high number of positive cases and they're epidemiologically linked in a school or a classroom, then the authorities in that school or classroom would usually call me and we would discuss it and see if the benefits of closing way outweighed the negative consequences of closing, because we really, we've learned in the last year what the consequences of closing classes and schools are. And although we obviously want to keep people as safe as we can from this infection, we also realize that for children, interrupting their education, their social development, psychological development, and so on and so forth, is a very big consequence of closing classrooms and schools. So where it was done with some frequency 6 months ago, we're really trying to avoid that.
Okay, great. Thank you.
Mhm.
Okay, and let's move on to Mendocino Action News.
Hello again. All right, I have a couple questions. Trying to put them together here. One is that testing kits seem to be hard to find for some, and it's a challenge for business. I know in the past, public health was able to hand some out. We see that as a possibility in the future. And in the same of that question is, if OptumServe is taking, 5 days to get your results back, if you don't have the option to do the rapid test, at that point, is it just for data, seeing that, after your 5 days, 10 days, you're off of quarantine if you don't have symptoms?
Good question. So the test kits are getting more easy to get through the federal government. Insurance companies, some are also required to pay for a certain number through some pharmacies. You can buy them at pharmacies, although they're scarce supply there, as as we were talking about the treatments, probably a little less scarce there, but you can call to get them through the federal government, and some of the insurance companies are required to make them available, or at least reimburse their insured people for these tests. We got tens of thousands of them into the county for the children in schools, and we also got them through the Department of Public Health and wanted to make sure that they were available to certain institutional providers, first responders, as well as areas that served people who were more disadvantaged and really couldn't get them on their own, but it was very important, like congregate care, shelters for the homeless, and places along those lines. We've made them available now, and the state has made them available much more through clinics. And I think that that's probably going to be coming online more and more as we speak. But I don't. And the other thing is that the community organizations that do want them, who find a need for them, businesses and so on, we've been recommending that they get them directly through the testing task force. And there's a way that they can just go online, and it's actually relatively simple and straightforward to get approved and get shipments of them. As I say, simple and straightforward. I mean, there are some hoops to jump through. Let me be honest. But it's available directly through the state testing task force. And as they get more, they will dispense more. There have been problems with the state obtaining more. So they've been, they had tens of millions on order, and they were actually informed after they thought they were going to be on the way in that they were bought out from under them. Others have been interrupted by weather events and problems with transportation and so on and so forth. So we're still in a stage where these rapid tests are scarce and relatively not available, but the situation is improving.
And then in regards to the OptumServe, if that's your other option,
Yes.
5 days for results.
Yeah,
is it
no,
just
I didn't mention that. So OptumServe at the peak of this Omicron, and when people were going in, what we call the turnaround time fell to somewhere in the range of 70% got their results within 1 or 2 days. And now it's back up to mid 80s to get it within 2 days. And higher. There are some that are getting it within 1 day. So it's improving, and they've made contracts, the state labs with private and academic labs to try and unravel this mess. But they're just backed up. So if you remember before Omicron, they were churning out results 85% within 2 days and in the 90s% within 1 day. This is our state lab, the VBL, Valencia Plants Lab. And it fell dramatically when they were overwhelmed with cases. And it's getting back online. They've expanded capacity, and they've solved some record-keeping issues that came up at around the same time. So I'm not saying things are perfect. It's in a growing mode, but they are addressing it, and it should get better.
All right, so it's right at 3 o'clock. We'll give Mendocino Voice a chance to ask one last question, and then Dr. Coren, feel free to go right into any closing comments you have.
Thanks. So California's statewide mask mandate is set to expire on the 15th of the month. And I've heard Governor Newsom hinting at an endemic plan or reading about that. I'm curious what Mendocino County's plan or strategy moving forward from the 15th is if the mandate is not extended, and just kind of that endemic is like, what does that look like? If you could talk about that a little much, because I just, I'm curious when the end of all of this will be.
Thanks for your question, Dana. We could talk about it. We could also dream about endemic.
Right.
Endemic is a scientific term when there's sort of a steady state and it's low enough. You can have an endemic and it can be horrible. You can get an endemic situation. It's not the end of the pandemic. It's a different phase where you don't have as high outbreaks as we have been having, and there is a more of a steady state. There may be a seasonal outbreak, and we're not at the point where they've described that. We're hoping that it'll be a little bit like the flu with the winter surges, but we also had that huge summer surge. So there's a lot unknown about that. So there's a lot of discussion about the endemic phase and what will we do. I don't have a crystal ball to be able to tell you, but I think what I would say is this: the governor, the public health has said universal indoor masking, and that went on for the last month. And on February 15th is when they're discussing withdrawing that, but they may not withdraw it all the way. My sense from what I've heard is they will probably leave it in some of the higher risk congregate settings that we want to protect. For example, healthcare facilities, probably transportation hubs. I would expect the schools as well to be universal indoor masking. There are some counties that have also had outdoor masking during this period of time, and that will probably be withdrawn. But I think, and then of course, businesses may be at a point where they need to decide on their own what they want to do. And I think the people will need to decide what they want to do in terms of masking. And that's the main mandate that still exists in our state. And I think that the governor was talking about. There are some other mandates. I know that the State Department of Public Health wants to have as few mandates as possible, but we all want to move to the point where there's guidance and advice, because that is much better the role of public health. None of us like to be mandating and telling people what to do that they don't want to do. We want to offer advice, like I've done for for decades as a physician, not telling someone you have to take this pill. That it doesn't work. And when we have done mandates in the community for the early stages of COVID, it's been really when you've had to protect the system, so that our health system, the hospitals, the nursing homes, didn't get so overloaded that they were not effective. And we would have people, well, in Southern California, there were so many people coming in and dying from COVID that they really had corpses that were in ambulances, or they were lined up. They didn't have the mortuaries for them. So the reason for the mandates early on in this pandemic were very different conditions than we have right now. And what will happen in the future is something that we're going to have a lot of discussions about. And I know that there's no, I don't have a secret insight into what's going to happen or how they'll move it. And we'll need to. It'll be dependent also on how threatening other variants could be. But just to clarify, endemic, there has been a lot of discussion about endemic, like there was a lot of discussion about herd immunity. And it's nice to talk about them, but when push comes to shove, you have to see how things are working out in the community and decide what makes sense. Does that help? Does that answer your question?
Oh yeah, no, that's great. Just to follow up though, do you know any information specifically in Mendocino County about this N95 mask federal distribution program that is supposed to be in effect, where masks are arriving to different states and they're supposed to be accessible through major pharmacy chains and community health centers?
Yes, and I don't know what the status of that is right now. I think that those are one of the items that's being distributed, and I think that there's a number that you can a number per week that you can get that they'll probably arrive at, but it's not slam dunk. I don't have details about that.
Thank you.
Dr. Coren, do you have any closing comments you wanted to give? We're a few minutes after 3, but
Okay, well, I'll
check
just
in.
wrap it up with this. I am hopeful. I'm sure we all want to see the end of this, and we're seeing maybe some light at the end of the tunnel coming in March, and that's a good thing. But it won't be the end of the story. There may be other variants coming up. So what we've done all along to protect ourselves continues to be really essential, and that is vaccinating and boosting right now. And I want to throw a focus especially on children. There's been questions and controversies about whether they should be vaccinated. While it may be less outwardly, obviously consequential for a child to get infected, the numbers that have been infected are going up, and there's a lot of suffering among them. And as well, there's a lot of data showing that for every 4 adults, for example, that are sick and pass away, a child, 1 in 500 is missing a caregiver. So it's very tragic for the children. They need to be boosted if they're vaccinated. Well, when they can be boosted, but they need to be vaccinated. And we've seen a slump in vaccinations because we're getting too secure. And I think we really need to prepare for other waves coming on. And these vaccines are very safe and really very, very effective. At the same time, don't forget the masks are very effective, and we've upgraded the types of masks to the N95 or medical masks. And the other mitigation efforts of social distancing and trying to avoid gatherings that might be high risk, doing more outside right now in Mendocino County, at least from where I'm sitting. It's a very sunny blue sky. That's a good place to be, is outside. So let's look to the future, and hopefully it'll come out to be as nice and blue or sunny yellow as we can imagine it. But we do need to take precautions. So I hope you'll tell that to your readers.
Great. Thank you, Dr. Coren. Thanks for everyone that listened in today and also asked questions. Our next update is scheduled for February 18th, Friday at 2 p.m. at the same time. And in the meantime, you can get our updates on Mendocino County's website or the public health Facebook page as well. So thanks again and have a great day.
Bye all.